you're using a ton of data these days. Can you guess what percentage we might be through this thing?
I'm sorry, I didn't get the last part. I apologize. Give me the question again.
Can you guess like what type of percentage we are through this coronavirus situation?
Oh boy, I really don't know. Until we get a vaccine, this virus is still going to be out there. And Ohioans have done great in the last 2 months. Now that we're opening society back up, which we feel that we really have to do, it's important for people to be extra careful because the virus is still there. There's a lot more intermingling with each other, and we just have to keep these numbers down. We don't want to overload our hospitals. We don't want to get more people sick. But I think it's 2 months. It seems like we've been doing this forever, but until we get a vaccine that's developed, I think we're going to be living with this. And so I think the real issue for us now is how do we live with it?
In that 2 months, I've gone back and forth a couple times. Have you ever wavered in your opinions or thoughts about this situation?
Well, there's no playbook, for this. I mean, we haven't had anything like this in 102 years. So, we're all trying to kind of work our way through this. I think we were fortunate in Ohio that we did make decisions early to close things down. And part of that was we had this Arnold Classic event in Columbus, and no other governor, I don't think, had closed anything major across the country, but it really presented the issue for us. You had 60,000 people that were set to come into town, stay for 4 days or 5 days, intermingle with each other, and they're coming from 80 countries, and we just decided that was just not a great idea. So the competition itself, the athletic competition occurred, but we did not have spectators, and I think that was the right decision.
And talking about groups, where do we stand with churches? What's the best course? The diocese here is starting Mass next week, and other churches feel if they can start, well, we can too. I've been confused on that for a couple weeks. How does that coincide with your gatherings of 10 or less?
Well, we have always exempted religious services. So there was never an order on telling people they could not go or that religious services could not take place. Now, we did say, we recommend you not do that. And again, I think it all depends as churches do start back, how they do it. It's what we know about this virus, and we continue to learn more, that it passes from body to body, and that's the main way that you get it. And so keeping that distance, figuring out how to keep people apart, the wearing of masks. I know that's not something we normally do in church, but again, that's an added protection as we start to go out. And when you wear a mask, you're wearing it really for the other person. They're wearing that for you, and that's just an added layer of protection. So I think as we go about our business and pulling churches back and religious services back, starting back up, people just need to be exceedingly careful. Some of the things that maybe we normally do, we gotta kind of rethink. In the Catholic Church, we shake hands with people. Some people hug each other at a certain part of the Mass, and that's probably not a good idea now. It's a good idea to keep your distance, stay safe.
Your daily briefing has gone from stats to wine with the wine to flatten the curve to predicting a baby boom to orders. And now that daily anticipation of what's reopening. What do you envision for the future of the daily briefing?
Well, next week we're going to talk about, give you a little preview, we're going to talk about something we're doing now with nursing homes. We're able now, because we have enough testing, to be much more aggressive. As you know, over half of the fatalities have come from people who live in nursing homes. And it's not because the nursing homes are necessarily doing a bad job. It's just that setting is tough. People live close together. These are people who are older. These are people who generally have some medical problems and conditions. So it's a very vulnerable group of people. So next week we're going to really start getting aggressive about testing. We're going to go in and test staff. We're going to go in and when it's medically indicated, test individual members of who are living in that nursing home, individual residents. So we can't do it overnight, but the National Guard has put some units together. They're going to be doing that. We're very happy that they're going to be doing that because we think it's going to make our nursing home residents safer.
Have you thought about presenting a total of active cases instead of a running total of cases?
Well, that's a real good question. We can't really keep track of the people that have recovered, but the bulk of people, of course, do recover from the virus. And because, what we have is when they go into the hospital or we have when they're diagnosed or when they, have COVID-19, but we don't really have good numbers in how many people recover. What we do have is on the other side of that, we have the number of deaths. So you probably could just take the number of deaths and subtract that from the number of cases, and you'd have a pretty good indication of the number of people who have in fact recovered. Some people are in recovery, some people are, in that phase, but that gives you a pretty good idea.
Kent says it's going to in-person classes in August. Do you agree with that? And will YSU get to make its own decision, or is this a state decision?
Well, I think every university is going to try to figure this out. They're going to try to figure out how can they get back in class, how can they do the social distancing, how can they protect their students. And universities, it's tough. I mean, it's tough. Kids live in a dorm. Some of the kids live in dorms. So, how do you keep that social distancing? So I think we're going to know a lot more as we get closer to the fall, both for primary and secondary schools as well as for our colleges. I mean, you think about it, we've only been at this 2 months and we've learned so much, we've seen so much, and it seems like an eternity, but it's only really been a couple months. Think 2 months from now and where we'll be at the end of July, and we're going to learn a lot more, and a lot of things will have changed between now and then.
The data today showed the state unemployment rate is over 15%. There are still people who can't get through. I interviewed one this week, Alexis Bowen. She wants me to tell you she's not mad at you, she just wants you to do something. Is there any sort of thing you can say to these people who haven't gotten through on the phone yet?
Well, I can tell them how sorry I am. That doesn't really give them much comfort. I understand that. What they really need is a check. We are now over, I think, 92-93% of the people who have applied have been dealt with. And as you know, we have to follow the law. Some people are eligible for the unemployment. Some are just not eligible because of their work record, because they haven't worked or worked enough. So we have to go through, our people have to go through each individual person. We started, when this virus hit, I think we had 44 people answering the phones, and that was adequate. That took care of the job. I think today we're over 1,500 people who are answering the phone. So we've ramped this up, but we also have a antiquated system. That's no fault of anybody, but there's an antiquated system there, and it's hard to ramp up very quickly. So we're making progress, we're getting there, but the only consolation, I guess, for anyone who doesn't have their money yet is you're not going to get cheated out of any money. That money's going to go back. That date will start the date you were first eligible, but that's not much consolation when you have bills to pay, and I understand that.
Senator Portman has told us that $1.2 billion from Washington from the previous stimulation to help local governments is in Columbus, waiting to be dispersed. Is that true, and when will that money go out to help?
Well, I talked to the Speaker of the House today and the Senate President about that. There is a bill. It's been passed in one House. It's waiting in the other House. As soon as they get this bill, this money will go out. So we're anxious to see that money go out. I know every community is anxious to see it and to get that money because the local governments have, big challenges. And What we see with local government, of course, is their costs go up and their revenue goes down. And you know, the first group that usually gets hit is the police and fire, because that's such a big part of local government's budget. So we don't want to see that happen. And so we certainly hope this money gets out as quickly as possible. And I've been assured by the legislature they're going to pass the bill, get it to me, get it signed, and we'll get that out right away.
Have you considered a stimulus to Ohioans from the rainy day fund? Even $200 would be nice.
Well, anything would be nice. We're going to need that entire amount of the rainy day fund, and thank heavens we have it. We're going to need that whole amount of money this coming year, beginning in July, really to keep from making some huge cuts. When you have unemployment above 16%, you know, the costs go up dramatically, but also the revenue goes down. And so we're had to make cuts. I've already made cuts of $760 million just for the last 2 months of the fiscal year. We're going to use that rainy day fund, and we hope to avoid, you know, cutting schools and cutting areas that it's just very tough when we make those cuts. But we're going to use all those dollars.
Okay. Do you envision a day of giving an all clear?
Well, I think when we get an all clear, everyone's going to breathe a sigh of relief, and a lot of plans that people have are going to get realized, and they're going to go on trips, and they're going to do things that they've been waiting to do. I know for Fran and me, it will be an opportunity to really get together with our grandchildren and really see them. We now can see them at a distance. We have 4 grandkids who live on our road. We walk down there and we get back and you know, see them wear the mask and then see them from a distance. But I think that will be a glorious day that everyone will be happy about. But look, that's not probably going to come, we don't think, until we get a vaccine. And in the meantime, we're going to have to figure out, as we're doing, how to live with this. And it's important that we keep in mind we got to do 2 things. We got to keep people safe. At the same time, we've got to be able to move our economy forward. And they're not mutually inconsistent. In fact, I think they're really tied together, because we can't get the economy back. We can't get people back to work if we have another outbreak, for example, a huge outbreak, a spike in the number of people who are testing positive for COVID-19. So we got to do both things at the same time.
Governor, my last question for you will be, in which areas have Ohioans struggled with this coronavirus, and in which areas have you been proud of the way they've responded?
I've been proud about the way Ohioans have responded completely to this. They've been phenomenal. You know, they've kept the distance, they've stayed home, they have kept space when they did go out. We're asking them to do one more thing now, and that is wear that mask, which is really a way to protect other people. More and more Ohioans are doing that. We're not telling them to do it, but we're asking them to do it. So I'm very, very proud of Ohioans. We're into a tough time now as we open the economy, and if we just got to keep doing what we've been doing.
All right. My time is up. I appreciate you. Nice talking to you.
Thank you very much.
Have a great day.
Thank you.